All right. I don't know why, but I'm quite excited about this webinar.
I am too. I was so looking forward to it.
December and the holidays and like the last one, the wrapping up the year. I don't know, but I'm kind of excited about this one.
Me too. No, me too. I feel the same.
All right. So welcome to everybody that's on Facebook. As I told Dr. Dempsey, I'm super excited about this webinar. I don't know why. I don't know if it's because it's the holidays. It's the 9th one. We're wrapping up 2019. I don't know. Plus, it's a lot of fun. We've been doing this for a long time. I can't believe it's almost like a year we've been doing this. It's been kind of fun.
It's so great. I really enjoy it. I was really looking forward to this today.
I really enjoy it too. So anyway, for those that have joined us before, welcome. And for those that haven't joined us before, welcome. I am Kendra Nielsen-Miles. I am the Executive Director and Founder of EDS Wellness. This webinar series has kind of spinned off into its own thing, but was actually originally part of our 2019-2018 video webinar and education program that EDS Wellness has been doing every month but now Dr. Tania Dempsey and this MCAS expert, but also we have had many other webinars with other providers, but this is kind of spinned off into its own thing based upon people's feedback and interest, and it's been really great. So if you haven't joined us before, thank you. And if you have, we're happy to have you back again for the 9th time. We are focusing today on stress, mast cell activation syndrome, and also just getting through the holidays. And I called it life hacks just because that's kind of a buzzword on Facebook. There's a group, an EDS Wellness, or not EDS Wellness group, but an EDS group called Life Hacks that happens to talk about MCAS a lot. And I know a lot of our reactions tend to get worse sometimes around this time of year for many reasons, which we'll discuss. Mast cell activation syndrome. So for anybody that is asking questions, please make sure that you ask the questions either in the chat Zoom feed, on the chat part, or underneath the feed on Facebook Live on Tania Dempsey's page. That's what I will monitor, both of them, ask her questions. And before we get started, just as a disclaimer, this is for medical information and educational purposes only. We try to answer as many questions as we possibly can. The broader, the better. The least personal, the better, only because we can't give medical advice. This is, again, educational and informational purposes only. I try to spin them so that it's more broad, and we try to keep it still tied to the focus. But with that, we'll just get started. All right, so no questions so far on Zoom. I'm going to go ahead and take a look at Facebook. But while I'm looking at that and reading anything, do you want to try to give an overview on, I don't know, maybe your top tip on getting through the holidays and stress, or just stress and MCAS, and how, let's just take it a little bit farther back, just the basic biology of how MCAS is related to stress and vice versa, and how stress makes MCAS worse.
Yeah, this is a very important topic, and that's why I'm really glad that we're covering it today, because we touch on this every time we do this, but I think it's important to concentrate it, because this is such a stressful time of year. You know, you have your normal life stressors all year round, and then you escalate it by adding the holidays to it. And there's so many reasons why the holidays are stressful. But what happens is, if we look at it from a biological perspective, mast cells have receptors on their surface that react to a lot of things. We've covered hormones. We've covered the fact that mast cells can have estrogen receptors and progesterone receptors, and they certainly will react with, let's say, a women's menstrual cycle, changes in the menstrual cycle. Well, it turns out that mast cells also have receptors for cortisol and for other cortisol-like compounds, and the hormones that cause cortisol to be released. And so it's a very complex interaction between those hormones and the mast cells. So the mast cells are reacting to, for instance, just to simplify things, that cortisol drive that happens, that increase in cortisol when stress is something that you've been dealing with. Cortisol can be released from the adrenal glands during like quick spurts of stress. But if you have chronic stress, which many people have, there's this constant release of cortisol that will then trigger mast cells, and then eventually the adrenal glands just sort of like poop out. They just get tired, they stop producing cortisol. And I think that mast cells actually probably see that also. through other mechanisms, the absence of cortisol. So it's complex, but the more things that you can do to manage your stress, the better it's going to be for you. You can't take away the stressors all the time. Sometimes you can, but if you can't take away the stressors, they are what they are. You have 20 people flying in from all over the world to spend the holidays with you. You're entertaining, or
going to a family reunion in the middle of December.
I was thinking of you.
That's very exciting that I'm doing. I'm just saying, like, it's like exciting for the stressor.
Yeah, major. Or what about you're invited to be with family, but you can't eat the food there because you react. You know that your family's going to say things to you that that are not going to be kind. They don't understand that you're not feeling well, right? And all these things, like, they just add up.
Right. I mean, you're excited, but you're sad because you're missing. You've lost family members that the holidays bring up a lot of memories.
Oh, right, exactly. And so, so what can you do? I mean, number one, just take a moment. You really need like 30 seconds, maybe even 15 seconds. Just take a deep breath whenever you can. Just stop. Put the phone away for a second, because that's the other thing. We're always connected, and I'm always checking my phone. I'm always checking Facebook. I'm always checking, right? All those things. And it just escalates the stress. So take a moment several times during the day. You put the phone away. Again, it could be 30 seconds. That's not going to change anything in your world. It's not like you're not going to accomplish everything, but if you just take some time, take some deep breaths. I love meditating, but you don't have to meditate. You just have to breathe.
Sometimes you just need to be silent, just completely silent, or take the dogs for a walk if you can walk, or just be alone.
And what that does is just dampens down that stress response.
Yeah.
It changes the cortisol release. It's really profound, actually, how
really. And there's been several articles actually talking about this. And it's been funny because I personally, this is a big thing for me. I like meditating and yoga and everything. But for me personally, being a very overly sensitive person to a lot of things, especially just chaos and noise and lights, as many of us are, like, I need to just I need the time, like, I just need to be alone, and I need to be silent. And my husband came from a very completely opposite family, and it was always seen as this thing of, like, I grew up kind of alone, and this was like, why do you need to be alone? Why can't you handle this? And now more research is coming out being like, this is what we all kind of need, especially in this world, and especially when we're dealing with stress and anxiety and chronic illness and all these things. So it's not a bad thing. And in fact, it's actually a very good resetting thing for the brain, mind, body, everything. I love the fact that you went over the biology of stress and MCAS at first, because I think a lot of us, when we first hear about this and you're dealing with so much pain and chronic illness and stress and get this diagnosis, when people say stress as can be one of the number one triggers for it, it immediately makes us think it's all in our head. And it's not. It's just more about understanding the biology and the biochemicals and everything that happens that affects it, even indirectly, directly, physically, internally, everything, and how we can actually help ourselves even when we can't go to a provider that can help us. There are little things like taking 5 deep breaths or whatever it is that we can do to help us. It's not going to be a miracle, but there are things. So I love that you went over the biology about it and just talked about just breathing. That was actually what I did for my kids. Instead of timeouts, their timeouts for 5 deep breaths before they could get up. I taught them that from the very beginning. I don't know how well I did, but hopefully it'll serve them well. Okay. Somebody said, one of the first questions, okay, everybody's talking about how great this is, a really great topic. Somebody asked, are there any vitamins to help with stress and anxiety to take around this season that could help us, kind of as a booster maybe, or, that are good to help around this time? Maybe it's not something you take every day, but might be helpful.
Oh, there's so many things, and I'm reluctant to go through too many and suggest too many, because of course, if you have MCAS, you could react to these compounds, you could react to the fillers in the compound. So I just want to preface this that these may be my favorite vitamins for this, but that it may not apply to you.
Right.
Vitamin C, for instance, is a really great vitamin on so many levels, right? So it is an antioxidant, it's an antihistamine, it boosts the immune system. There's so many things, right? And there are many MCAS patients who tolerate vitamin C if they find the right formulation, but some don't. So I just want to say that this doesn't, of course, doesn't apply to everybody. But vitamin C gets depleted with stress, and so you almost need more to compensate for times when you are stressful. So I recommend, again, vitamin C could be a great supplement, again, for the right person with the right formulation.
Right, right brand, the right brand and the right combination.
Exactly. But given all that, right, vitamin C, B12 also gets depleted with stress. Lots of MCAS patients have issues with B12 absorption, B12 metabolism. There may be MTHFR mutations that affect folate and B12 metabolism. And so the right B12 and the formulation that can be absorbed and in the right formulation with the right fillers can be very, very helpful during times of stress. There are herbs that I sometimes use, I'll call them adaptogens. They're adrenal herbs that help the adrenal glands during times of stress. And if there is an underlying adrenal insufficiency, it can help. Some of these herbs have some positive effects on mast cells, but like everything else, things that could help could also backfire. So rhodiola, ashwagandha, again, can be
holy basil, right? Holy basil is another one. I drink that in a tea. And it's something that it's not necessarily, I find that it's better absorbed because it's in a tea and liquid versus like taking a supplement, especially with those of us with GI issues. And you can take all you want, but if you're not absorbing it, how can it really help us, right?
Yeah, that's a good point. And that's another problem, because many MCAS patients have absorption issues just in general for a variety of reasons. And getting the supplements and the nutrients you need in the right form that you can integrate into your cells is critical.
Yeah, that's very critical. And it's really hard when you have GI issues. So along that same line, there's two questions that kind of piggyback on that. So somebody mentioned, do you have any kind of typical like adrenal cocktail? I know we just talked about the supplements, but any kind of special cocktail in a roundabout broad way that I think you kind of covered it, but is there anything that's better to support the adrenals or reduce the impact of stress and cortisol? Different than what you just said.
Different. Well, in addition to those supplements that I mentioned, oh my gosh, there's so many things. So I'll sometimes use, so what's it, but I guess they're asking for a cocktail.
Yeah, like is there any kind of good combination?
I have a great cocktail that I actually manufacture myself and I sell in my office. And it's not good for everybody, but it has ashwagandha and it has the rhodiola in it, and it's got a little bit of B6 and it's got a little vitamin C and it's got a little bit of, without going overboard, this sort of blend of vitamins and adaptogens that support the adrenal gland.
It sounds similar to, I personally, not recommending, this is not an EDS wellness recommendation or anything. It just happens that two supplements that I take are Dr. Wilson's vitamin adrenal C and stress something support. I don't know why. It's a good combination for me. It works. It's adrenal C and some kind of supplement. I don't react to them. It's got a good combination, but not too much of whatever's in it. Most importantly, I don't react to them and I can digest them. I don't know how much they're helping me, but I don't know. That and the holy basil tea I drink pretty regularly too. Again, don't know how much, but my personal experience has always been the 5 deep breaths and just being quiet has been the most helpful of like everything. All right, so moving on to past the supplements and everything, how would you recommend somebody deal with, this is a big stressor for a lot of us, and I can identify with this one too, deal with hot rooms and perfumery. I'm sorry, I'm not laughing, but I just laughed because I totally get it. Perfumery people, like in church or family gatherings, because, oh gosh, it's so true.
Yeah.
And I don't mean to laugh, but sometimes you have to laugh when you have these conditions and the things that bother you.
Yeah, you laugh, but not at the moment.
Right. Yeah, at that moment you feel like you're being suffocated and dying. But
I think that this is easier said than done, but you have to look out for yourself because no one else is going to look out for you. So if you are not comfortable, you have to, you have to leave. You have to figure out a way to leave. Maybe that's not possible. But, if you can find a way to go outside, breathe some fresh air, especially if the scents in the room are really strong or the heat is really strong, you can ask the person, let's say you're at their house, maybe they can lower the heat, but it's hard because so much of this is actually out of your control. You can control what's going on in your own home to some extent, but certainly when you're out, it's impossible. And right now, I know a lot of my patients are having issues. They're going shopping and department stores.
Oh,
and they just smell like one big bottle of perfume.
Oh, the lights, the
heat, and the smell. Right, that's why online shopping actually works really well.
I mean, I'm spending a lot of money because I'm like, I gotta get out of here.
So, yeah. So, what else can be done beyond that? I don't know. It's
I have to say that's the only benefit. As much as I would rather live in Florida or a warm climate where the sun, because dealing with the sun going down so early is so hard, and I don't love the cold. But I find that being able to just go outside in the cold when dealing with those situations specifically is a savior for me personally. Anyway, so okay. Somebody else asked, what happens or what do you do if, you can't take these supplements and you can't eat the food because your MCAS basically is you can't tolerate food. I know we've talked a lot about food and nutrition, but again, food is a big part of the holidays. It's a big part of community, and it's a big part of trying to just engage and being part of it. So is there any kind of suggestions you could have for GI issues when you especially can't eat food and that just causes even more stress?
So is a question about what my recommendations are for treating the GI issues, or?
Let me go back and I'll read it.
Yeah,
exactly.
Clarify.
There's a lot of questions. They're all great. Everybody's been really awesome about these. Okay, what happens when the gut stops allowing food? Pretty much.
Yeah, that's a tough situation, and one that unfortunately many MCAS patients deal with. It always goes back to you have to treat the MCAS. If the tolerance to food is going down, that means that the MCAS is worse, at least at the level of the gut. You might not even notice that other symptoms are worse, but certainly if the GI tract is not accepting food, then for sure MCAS is going wild in the gut. And so definitely working with your healthcare providers, trying to find the right protocol to deal with that. But, trying to eat foods that are available to you around holiday season is not going to work, right? So you can't just experiment. You have to be prepared. And yeah, it's a tough one. The point is that there's no specific treatment that I can say, if you do this, this is going to treat everything, right? I have a patient who tried cromolyn and their food tolerance went up dramatically in a very short period of time, went from 3 foods to 20 foods and then more, right? That was the key to their
magic pill or their magic thing for them.
Right, but it could be something else or something. Just because cromolyn is for the gut doesn't mean it's going to work for your gut. But the point is that I find that the food issue does seem to respond, and it takes time until you find the right thing to MCAS treatment and making sure you've also ruled out everything else. Because one of the things that I see a lot is gut infections that drive the MCAS. So you could, try to get the MCAS.
Actually, I think in the last webinar.
We did.
Yeah.
Yeah, we did. And so if there are parasites, if there's SIBO and other bacteria, right, that's just going to make this situation worse. So I like to look at things. I can't do it any other way. I can't look at it just like an MCAS lens. I see MCAS and how it relates to all these other things. And I always want to make sure that patients and their healthcare providers are thinking, okay, what are we missing here? Something's not working. You got to go back to the drawing board and figure it out, Right.
And the gut and the brain are so connected that if you theoretically can calm down the mast cells elsewhere too, it could also help the GI tract in the way that it's responding to. this might be a little, it's related to GI symptoms, related to stress and MCAS. That might be a little bit easier to talk about. But if stress affects the GI symptoms, when stress is up, people get the runs. Not going into TMI. Is there anything to help with that? I mean, I think a lot of people deal with this too. You know, when stress is up, the GI tract tends to go kind of crazy. It can either be one way or the other.
Yeah. Yeah. And again, it goes back to trying to manage the stress in the first place. Try to take some time for yourself. Try to, you know, breathe and all that stuff. How do you deal with the acute issue? That's not so easy. You know, I think about if you know that you have a rescue medication for your MCAS, whatever that rescue medication is. For some of my patients, it's hydroxyzine. For some of my patients, it's diphenhydramine or Benadryl, right? Some of my patients, it's Ativan, and some of my patients, it's something else, right? So whatever I'm sorry?
I said,
I didn't hear it. Okay. Which one? Valium?
I said Valium. It was another benzodiazepine.
Correct. So whatever your rescue medication is that works, if that happens, then you have the runs, or, you know, your GI tract goes out of whack because of the stress, then rely on some of your rescue meds. You might need more during this holiday season, and that's okay. You know, a lot of my patients worry about taking too many medications and, you know, having to use a rescue all the time. You know, they're there for a reason, and as long as they don't cause additional issues for you, I think it's worth trying.
Yeah, somebody mentioned, you know, we don't have to go fully into this because I know everything is so personal, but somebody mentioned also medical marijuana can sometimes help with this. Okay. Another question. So I will say somebody mentioned also this on Zoom, and this is a good point too, is that for stress relief, somebody mentioned getting rid of the toxic people in their life, you know, kind of cutting out, you know, people that might just not be adding to your life and causing things worse, even if it's one people, a couple people, it could even be family, as hard as that is, but recognizing what that's doing to your life. And anyway, somebody
that's tremendous.
And how much better they feel. All right, so somebody said, this is a question from Zoom, because I have asked most of the questions have been on Facebook so far, and there's been more, but I'm just gonna go to Zoom a little bit. How do I get my doctor to understand that my pain is from MCAS? It's my worst symptom is abdominal issues are really bad. They usually get a work around it and have horrible all over. I usually can work around it, but not the horrible all over pain. So this is more of just a suggestion of just speaking to the doctor and get the doctor how can we get our doctors to understand that the pain or issues are related to MCAS, especially at times of stress, which just causes even more stress if the doctor's not listening to you. Are there any suggestions that you have?
Well, first of all, there are a few published articles on pain and MCAS.
Yeah.
And, you know, Kendra, you and I can work on getting them and sharing them.
Sharing the lists.
You know,
and they could share that.
But Dr. Afrin, but you could also just Google this. Dr. Afrin did publish a couple of years ago, I can't recall, I want to say maybe 2014 or 15, but I could be wrong. But he published a article with a few other authors regarding the link between MCAS and proprioception, really pain disorders. He has a great schematic or diagram, or it's actually a picture of all the different pain syndromes that are associated with MCAS. And included in that diagram is fibromyalgia and interstitial cystitis and migraines, all these things that we think of as you know, causing or a type of chronic pain, but it can also cause just systemic all over pain that it doesn't have a diagnosis. So that article, you know, it's scientific. So I think if you could share this type of information with doctors, I think that they may relate better to it, because again, it's coming from a scientific source rather than the patient just trying to tell them that's what it is. So that's one article. There's another one too that I'm thinking of. So I think sharing data like that and information is important. And you know, otherwise, I don't know how you convince somebody whose head is
not willing to listen. I mean, they're either going to be receptive or not. I guess maybe how we approach it as patients, not coming as it combatively and saying like, you must do this, but saying, I would like you to be a partner in my healthcare. I would like to share something with you. Are you willing to read it and consider it? If you're not, just let me know. I want to continue working with you as a partner in my healthcare, but if this is totally out of your realm and you're not comfortable, just let me know. I think sometimes as patients, our approach is really important because as providers, we don't know what's going behind closed doors. We don't know what you're dealing with personally, what your capacity is. And technically, I mean, you don't have to necessarily read anything or help us. I mean, obviously there's ethics involved, but coming at it combatively is not going to help anyone. So I find that our approach is also really important.
No, yeah, I'm glad that you mentioned that. I think that is important. But even doing that, you know, I have patients that I know they probably approached it that way with their previous doctors. You can't, you can't change somebody who's so set in their ways. And unfortunately, lots of doctors are. I'm not going to generalize, but so you can help. You can say you want to be partners with me. You want to give them information, and then if you have to, you got to find somebody else.
Yeah, we have to also be okay, and as hard as it is, especially just trying to find somebody to help us moving on, and it's hard. Okay, this is a great question. What about anxiety and depression? And this is a big one around this time. It adds to the stress, caused by the stress. Anything to help with anxiety and depression around this time or involved with MCAS. Somebody mentioned their husband is having a really hard time. I personally also know and see the ups and downs with this too. And it's kind of this crazy phenomenon. And sometimes you, as a person that deals with it, it's hard to know what's really causing it or what the ups and downs are. So do you have any kind of strategies, tips, other than what we've already discussed to help with anxiety and depression?
Well, I'll reiterate some things though, right? So if the anxiety and depression is being triggered this time of year, that means the mast cells are being triggered, right? So I would try to see if there are additional MCAS medications or what are treatments that could target that. Sometimes medication is needed, right? If you're very depressed, I always say sometimes you need a Band-Aid to get that under control so you can get everything else under control. Doing some other thing. I'm going to mention something that doesn't necessarily apply specifically to anxiety and depression, but I think it's important. There are these programs out there like DNRS, the Gupta program. There may be others that sort of retrain your nervous system. Yeah. And I wouldn't use that as a substitute for everything else. But basically what we're talking about when I'm saying breathe or meditate, it's slightly different, obviously, but it's the same concept. You have to get your nervous system controlled, which will ultimately lead to mast cell control and control over mood and other things. So I think it's important. I think it's useful for some patients to try even something like that.
Yeah, I completely agree. And the way that I explained it to somebody the other day is that it's not that one of these programs is the be all end all. It's more about what works for you and what's best for your recipe. And in a way, it's kind of retraining our mind-body connection, but it's also retraining our story. I was specifically talking about movement and our fear of movement in this case to somebody, but sometimes we have to work with our mind-body connection to redo our movement story, to retrain so that when we're in something that was triggering something before, that our body isn't immediately going to this protective mode that can cause more pain during something. It's like these programs I find are like about retraining your story in a situation to help calm down the nervous system when you're in that situation again. Is that another way to describe it, would you say?
Yeah, definitely. Thank you.
Okay. So can you go over, somebody asked, could you go over again the biology of breathing? Again, somebody said, can you go over the biology of breathing again?
Yeah, I didn't talk about the biology of.
Okay, would you mind going over the biology of breathing as it relates to MCAS, stress, or the biology of breathing?
I don't know. I have to be honest. I don't know if I can actually explain it off the top of my head.
Okay.
The biology of it, but I will say, just generally speaking, breathing calms the nervous system down. It's just, you take a deep breath and your sympathetic nervous system gets a little bit, controlled, I guess, is a way of saying it. So breathing slowly, eliminating the stimuli around you, like the phones and other EMF producing objects, will just calm down the sympathetic nervous system. So I don't want to go into like the real like science stuff, because it'd be easier if I look that up and explain it to you in a real technical way. But
yeah, and I know I personally, we have like no sound in our house. I mean, there is sound because we have 3 kids and dogs and a cat and whatever, but we have no doorbell. We have no home phone that rings. My cell phone never rings. We don't have a TV in our living room. We do now right now because the one in the basement doesn't work. But I've eliminated sound. I mean, sound is a big thing. Now, Alexa, I've had to come in terms with Alexa as she hears me now, because now it's what the kids use as their alarm. But we have this whole thing about sound, and I need that for my nervous system. That's just one thing. I mean, a lot of times we have to control our environment and shut off the things that even we may like, including our cell phone. My husband just added, thank you for the water. All right, and okay, so let's see. Maybe this is a little bit easier. How do you know if you have anaphylaxis or simply having breathing issues? Maybe that's more related to kind of anatomy, biology of breathing. So how do you know if you're having, let's see if I can word this better. I don't know, is there a difference between breathing issues and anaphylaxis? Of course there is, but I know there's different stages of anaphylaxis. Like, how do you know? I don't know, they're both very serious to me, so I don't want to ever say one is worse than the other. I don't know how to, I guess, how would you know if you're having like a real episode of anaphylaxis that is getting more serious? Maybe that's a better way to explain it. To the person that asked this on Facebook, would you mind maybe clarifying if I'm not answering this quickly, best? The only thing that was said to clarify is some don't have the typical anaphylaxis symptoms with breathing issues, I think.
Yeah. So many patients don't have anaphylaxis and many do, right? They're just different manifestations. MCAS is just it's a multi-system disorder and presents in so many different ways in so many different people. So you don't need anaphylaxis to have MCAS, according to me, although I understand that the consensus group came out with a statement that said that anaphylaxis is important in the diagnosis. I don't agree. But there are patients who look pre-anaphylactic or anaphylactoid. So they have symptoms that suggest that they're going in that direction, but they don't ever get to that direction. And if they intervene quickly enough and they take Benadryl, sometimes they don't even take Ebv. I have lots of patients who take Benadryl and are able to abort that attack, and then they never became anaphylactic. How do you know you're not going to get there, though? That is very, very complicated, because I don't know. If I'm not in their body, I don't know how they would know whether that's a possibility. I think when in doubt, you call 911. You don't play around. You don't wait to see if it can transform, especially if it starts to go really quickly.
Yeah.
I have patients who never really get anaphylactic, but they're always pre-anaphylactic. The throat gets tight, their tongue swells, they can't breathe, they get short of breath, and they take Benadryl and Ativan or whatever else they take, and they're able to, within a short period of time, go back to normal. So there is a wide range in terms of the reactions you can have, and a wide range of how you can respond. I have patients who need to do epi, otherwise they're never gonna transform. So it's a really good question. It is very hard. A lot of my patients are confused about this, and they'll say, well, I never really had an anaphylactic reaction, but I remember I ate something and my throat was getting tight. Okay, so but it helps with understanding and with treatment and diagnosis and all that.
Yeah, and I will also say, because my life is an open record, so is my personal life. Both my boys, Halen not so much, but have this inflammatory reaction of their throats, and it's not asthma and it's not necessarily anaphylaxis, but it's caused by a narrowing of the trachea, and any kind they have an exercise or heat induced inflammation, probably caused by genetics that they inherited from me. Their throats, they can't breathe. It's treated like asthma. So we use, inhaler, the nebulizer. It gets worse with sickness or exercise or heat. The fluids are super helpful, but it feels like an episode to them, and they literally can't breathe. So that's just another type of breathing issue that I've noticed, but it's not so much the lungs, it's like the air getting down the airway. And that's just what I've learned as a mom. So that's just another side point. Okay.
Can I mention something, Kendra?
Oh yeah, go ahead.
On Facebook, someone is saying that the signal is not great when I'm speaking. And I just want to know if anybody else is having that issue.
Now, I will tell you from my end, we can ask if somebody else, I notice a little bit on my end from you. I'm not getting the internet shaky on my end. I don't think it's my internet connection.
No, but I hear you shaky too sometimes.
Okay. I haven't noticed that it's affecting us being able to listen to you. We're not having trouble continuing, so it's been able to continue, but I don't know. Let's see what the people say. I'm not getting any warnings from Zoom, which I usually do. Okay. So let's just see. Can anybody comment on the quality? I guess somebody else has mentioned it.
Yeah, someone said it's okay.
Yeah, I don't see.
Just as we go, just let us know, okay?
Yeah, let us know if everybody's saying it's, other people are saying it's okay for them, fine here. Other people are saying it seems fine to me on Facebook. Let's see if anybody mentions on Zoom. Somebody mentioned that we can hear both okay. Somebody mentioned that Zoom cut out for a few seconds, but nothing. Okay. So just let us know. We'll continue. Okay. We're moving right along. It's 7:40. Look at us flying through this.
Wow.
Not trying to fly through it, but it's it's a good topic. Okay, I'm trying to go back to Facebook. I think we answered that breathing question.
Yeah, so a few people are saying that it is fuzzy sometimes.
Fuzzy sometimes, okay. I'm not quite sure. I don't know how to fix that. I'm not getting necessarily anything on Zoom end other than, I can try.
And I apologize because I know that our internet was like a little funky a few hours ago.
Okay.
And we had some snow last night and ice, and I don't know, maybe
just technical issues.
I'm going to blame it on that, but I don't know if that's what it is.
I don't know. I think we're pivoting okay with these technical issues that we deal with. But yes, sometimes internet can be shaky. But it seems okay on my end and on the Zoom end. And it doesn't seem like it's cutting out a whole lot that people can't follow.
Good. But so let's go on.
All right. So we'll move along. But if something happens, just let us know. Okay. All right, sorry, I'm reading, going back and making sure I'm just trying to follow. Okay, what about stress-causing migraine headaches? Are hemiplegic migraines related to MCAD? Now, hemiplegic?
Hemiplegic, yeah.
Okay. Are they related to MCAS, or can they?
Yeah, so I'll start with the second part first and then I'll move up. But yeah, absolutely. There is a link. Well, there's a link between MCAS and migraines, period. And hemiplegic migraines are just a form of migraine headache. It causes a paralysis, almost like a stroke.
And that's different than the focal aura ocular migraines? Is that a different type of migraine than that?
Okay. Different type, exactly. And we know through, this is not opinion here. This is science, and we have literature to support it, that we know that the mast cells line and protect all the nerves in the body. We know that mast cells are in the vasculature and they line the arteries and veins and capillaries. And we know with migraine that both the vasculature and the nervous system is involved. And so stress can be a trigger for MCAS, which can then trigger the migraine. So anything that triggers the MCAS can then manifest in a variety of ways. So if your weakness is migraines, that's going to be the way it's going to manifest. And if it's hemiplegic, then unfortunately, it's really, really disconcerting symptom to have. It needs to be treated quickly. But anything that stresses the mast cell out, off is gonna affect anywhere in the body that is really, and I call it a weakness, because it does seem like everybody has a different area of the body, but it could be multiple areas of the body that seem to react more than others.
Okay. Somebody also mentioned along the lines of headaches that they have systemic mastocytosis, really bad headaches that went away when they started Rydapt. It's a medication, I guess, if I'm saying Rydapt, R-Y-D-A-P-T, for a few months now, and now the headaches are back. So we're just asking more general, maybe different type of headache. This is not necessarily, it's a different question about headaches than the one that you just answered, but is there anything else that might be really helpful for headaches, dealing with mast cell or mast cell activation disorders? I'm just trying to keep it more broad versus personal. If they don't have those type of migraine headaches, anything that helps with headaches in general?
Yeah, I know. Again, it goes back to treating the MCAS.
Yeah.
So if they have if they're not adequately controlled with their MCAS drugs, then we definitely need to look at that and get treated. Now, there are some migraine meds that are sometimes needed and helpful, and it's not clear. They might have some positive MCAS effects. Sometimes it's not clear. They're working through other mechanisms. So again, I don't think there's a specific treatment that I could say because everybody's so individualized. But for instance, I have a patient whose migraines went away with Claritin and Pepcid. And when she gets a rare migraine these days, she knows she takes an antihistamine and lots of fluids and lies down, and it goes away now. Whereas before it could transform into day-long things. So again, it's so different. Everyone is so different that I it's hard for me to even just put down one thing. Yeah.
Yeah, that's understandable. There's a couple questions on Zoom. Let me ask this one first. So if you have clear signs of adrenal insufficiency caused by stress, and have MCAS, is it useful to do testing on the HPA function, or what other tests are recommended? I'm just reading the question, so if I'm not saying it correctly, please let me know. I tend to butcher things, so I'm sorry.
No, it's a great question, actually. Absolutely, further testing needs to be done. So if you suspect, or your doctor suspects there's some adrenal insufficiency or low adrenal function, depends on the extent of it. But let's say it's mild, that you think it's mild. It's bad enough that it's impacting you, but it's not severe and you're not in the hospital. And I'll go through what I'm talking about. But I really prefer doing salivary adrenal testing. There's some research that suggests that the adrenal hormones are secreted into the saliva at more physiological levels than in the blood. So I'll sometimes draw a cortisol level in the blood, and I'll get some information from that. Yeah. But I like doing a 4-point saliva test that measures the cortisol through the course of the day.
I was going to say that 4 points is like when you spit into a little canister during different hours of the day.
Yeah.
Yeah, it's actually a very easy test to kind of do as a patient. It's not very cumbersome.
It is, and it's
definitely more pleasant than some of those other GI tests that I won't go into.
There you go. What we find is that patients are then able to understand, looking at the graph and looking at the time, why they feel a certain way. So, a lot of MCAS patients, and not just MCAS patients, just a lot of my patients, because they're coming to me, they don't feel well, they get a second wind at night, and they are the night
about that.
Right, I know, right?
I gotta laugh at a lot of these things. I'm like, I don't know anything about that.
So the point is that they're often concerned about it. They don't know why. When you do this test, you see that the cortisol levels actually start to rise during the time when they're getting more energy. So there's a disconnect. That's not what's supposed to happen. At night, the cortisol levels go down. You go to sleep. You're supposed to be calm. And in MCAS, but in other chronic illnesses, the adrenal glands get dysregulated and they start producing cortisol at the wrong times. So they're just not working the way they should, and sometimes they're not even working enough. So the saliva test I like the best. I happen to like Labrex, which is now owned by Doctors Data. I just like the data that they give. They also are now doing melatonin levels, which is also very interesting. I also do all the hormones that way too, estrogen and progesterone and all that. So I think that's very helpful. Now, there is a condition called Addison's disease, which is true adrenal insufficiency. And I have a few patients with MCAS who have developed adrenal insufficiency. Many of them, actually a couple of them have had Lyme disease and have been very sick from that. And then their body just sort of shut down, the adrenal glands shut down. They don't produce cortisol anymore. That's dangerous. And what happens is they often don't know it until they have an acute stressor. Often it's an infection. It's something that is major and they can't fight it because they don't have any cortisol. And cortisol is your natural anti-inflammatory agent. It does a lot of things. It talks to a lot of different cells in the body. And so without that, you really can't function. And so they go into an adrenal crisis and then they need steroids and it's a whole other thing. So but I have patients who have mild symptoms, but are on the verge of going into this adrenal insufficiency, and that requires more testing, more thorough testing beyond just saliva. So I just want to make a point of that.
Okay. More feedback on the connection. Everybody says a little bit here and there, but just to continue. So we're going to continue.
Yeah, I would try changing the internet band, but I'm afraid I'm going to get disconnected.
Yeah. Yeah, I mean, you could always do that if you wanted to and try to log in, but it seems like it's okay that people can still follow. They're not losing anything and they just want us to continue. So unless that's different and it's changed since then, just let us know. But I'm going to continue unless there's a big issue that is happening that we are unaware of. Can you touch on estrogen hormones and migraines a little bit?
Yeah, that's an excellent question because as we've talked about before, mast cells have estrogen receptors on their surface. They react to estrogen in various ways. And some of it is not bad. I always make it sound like estrogen is bad. It's not bad. It's just when it's not in balance, when the mast cells are somewhat primed to it, then it can cause some issues. And so can the absence of estrogen. So during that time of the cycle, when the estrogen starts to drop and you're about to get your period, that can trigger MCAS too. So the point is that the menstrual cycle affects mast cells, and mast cells affect migraines and cause migraines essentially. So the link is very clear to me. Maybe we need more research on that, but my patients who have hormone-related migraines I'm trying to deal with their MCAS underlying it all, and that is helping the hormone piece and the migraine piece. So I always go back to, for me, the MCAS piece has to be dealt with first. Sometimes you need Band-Aids, you need things to deal with the symptom, but ultimately the root cause has to be addressed.
Okay. I have a couple other questions. I'm going to try to, of course, several other, but I'm trying to go back and forth. There's a couple on Zoom. Do you have any tips for handling herpes simplex virus? Flare-ups occur under stress, which, I know a lot of people, I'm sure, with MCAS have this too. So do you have any suggestions for maybe comorbid conditions that also flare up during stress for those that have MCAS? That's probably a better way to say it.
Yeah.
Or anything specific for herpes simplex virus that flares during stress?
Yeah, no, I mean, antiviral medication, unfortunately, does often work. Lysine, I use a lot. If you tolerate it, can be helpful in during a flare or to even prevent a flare. So I have patients who stay on lysine or go up in dosage during stressful times to prevent. Same thing with Valtrex and Famvir and all those drugs that are sometimes tolerated and sometimes not. So you have to treat the virus. I mean, the concern that I have about not treating herpes in some way is that there is some research that suggests that herpes may be getting into the brain and linked to Alzheimer's and a variety of other things. So I think that it's important to suppress that virus as much as you can. But there are other things that can flare during the holidays with stress. You mentioned herpes simplex, which is cold sores. But herpes zoster, which is shingles, is not uncommon during really stressful periods in people's lives.
Had that twice.
Yeah.
Specifically after a horse ran away with me on at the Greenbrier Resort during holiday time.
Oh my gosh.
Never feared for my life like that, and immediately got shingles like, a couple days later, but I had it first when I was 12. And I was at that time the youngest kid that had it, which is very interesting. But yes, I've had that twice, caused by stress. That's when I know I'm really stressed. Somebody said, how do you know, what I'm going back to asking, there's a couple of really good questions. Can late onset viral asthma be related to MCAS? I don't know necessarily, I'm just reading the questions. I don't know what late onset viral asthma, what that would mean to you. I'm just reading it. Late onset viral asthma be related to MCAS. Not, the first episode was in her 30s.
So I would call that post-viral bronchospasm. Mm-hmm. So it's basically people get a bronchitis, pneumonia, the flu, and it's viral in origin, so an antibiotic won't necessarily help, and they get the inflammation in their the bronchial tubes, and it becomes an asthmatic situation. Some patients develop it with a particular virus and they never really get rid of it. In other words, they always will have a flare when they get another virus. And the question is, why does it happen in adulthood and why not in childhood? It can vary, but is it associated with MCAS? Probably. Probably that virus triggered an underlying predisposition to MCAS. I don't think that this happens in everybody, right? So I think that there has to be the right genetic profile, and then there's the trigger that sets it off, and the trigger could come at age 10, could come at age 35. I have a patient who really didn't present with MCAS until she was about 80. So I've seen it all, right? So she probably had it, just didn't present until she had a real big stressor, an infection that set off that underlying predisposition.
Yeah, which seems to be very similar to a lot of things we've talked in these episodes about these viral different triggers that happen, whether it's Lyme or mold, which reminds me of a question that was asked earlier, but I'll go back to that. But can you go back to when you talked about the saliva test for cortisol? Can you still take that or do that if you're on 2 to 3 milligrams of prednisone?
It's a good question. So it depends what information you're trying to get. So the test kit will say, don't take, when you're taking certain hormones and when you're on cortisol or prednisone. Having said that, I sometimes will do the test when patients are on those things because I actually want to see what that thing is doing for them.
Right.
So what I might suggest is, especially if they can't wean off it, if this is something that they've been on for a long time and there is no way they're going to stop, I would do it. And take that information with that knowledge that the prednisone was on board, and then you see, and you might find that even with prednisone, that it's it's still low. The adrenal function is low, and which may suggest that you need either more prednisone or you need actually hydrocortisone, which may be better than prednisone. But again, it gives it information. So I'm all for doing it, even if you're on it. It's the same thing with stool tests. They say stop your probiotics, don't take your stool test when you're taking all that stuff. And I sometimes want people to continue it because I really want to know on the probiotic what their gut looks like. And sometimes it doesn't look good, which tells me that the quality of the probiotic or the quality of the gut is not.
Right. That's a great point. And I think so many of us have that same question of, do we stop our meds? What does it mean? But I think just like you, in the terms of, well, wouldn't it be really great to see what's really happening and if it's helping or not? Right. How to happen? Yeah. So along the same lines of talking about medication, and if you can maybe answer this more broad, and I think this is a great question, is there a limit, or how much Benadryl can you take if you're in a pre-anaphylactic state? I know that when you look at the bottles, like they give you a certain thing, but is there a protocol out there, or just kind of a line? I'm trying to keep it broad because I know it's very personal. I'm trying. But I think it's a great question, and I don't know if there's information out there. Is there a certain amount, anywhere we can find this information, or if you can share it?
Not that I know of. I don't think there's any information out there. and it is very individual. And I'm going to say this, but understand that I'm not giving advice, right? And I'm not telling you to do this.
Right.
I'm saying that I see patients with a wide range of tolerance for Benadryl. So, I had a patient who was probably taking 300 milligrams or more a day of Benadryl. And I have patients who, can take 25 or 12.5 even, and get the result that they need. So what I would say is that you have to do what you can to get out of a flare.
Yeah.
If you are requiring a lot of Benadryl very, very often, then clearly Benadryl is not going to be the answer completely. So you need to make sure that there are other things that you're going to be trying. And then in some patients who have a really high Benadryl need, then in some cases, I'm not saying, again, this applies to anybody here, but sometimes they need a continuous infusion of Benadryl intravenously, worst case scenario, because they need so much, they're taking so much orally that they can't keep up, and it's not really helping because there are times when the levels are going down. So you give it continuously. So I don't know if I answered the question, but I don't think that I can say, what the threshold is. It's just clearly more than 25 milligrams 4 times a day. I've certainly gone above that.
Yeah. I'm just going back up to the question that I mentioned, and I actually have to plug in my phone so I can make sure I can go back and forth. So I'm going to ask this, and I'm going to step away to go get my charger real quick, and then come back and then go back down to the questions that are, more recent. But this is the one I was talking about. So for those that have Lyme or mold issues, stress can obviously be aggravated, especially during this time. If you have MCAS, how can you tell the difference between a Lyme or mold symptoms? Somebody's flaring, or especially if you're flaring and you can't tell why. So the question is the difference between Lyme or mold symptoms, I guess, related to MCAS, triggering MCAS, especially maybe during stress or this time. Is they're flaring, they don't tell why. Is there any way to tell the difference? And I'm going to get my charger while you're answering that.
It's virtually impossible, as far as I'm concerned, to really know without understanding the history. So if we could narrow down exposure to mold, that was the trigger that led to the escalation in symptoms. Sure, that's easy. For some patients, it's not even external mold, it's internal mold. It's Candida, and it's other funguses that are growing inside that are causing the problem. I know somebody mentioned about breast implants.
I was just going to mention that.
Yeah, it's important because we know that there have been people who have had mold growing on their implants inside their breasts, which are definitely going to give them mold.
Well, and they had no idea that they explanted it for other reasons, not even thinking this, and then they came out and they had mold.
Yeah. No, it's really bad. So the point is that when we use the term mold illness, it's so complex. It's not so simple as I was in a moldy building. It could be that simple, and that's not so simple, but you need to look at all that. But the symptoms overlap with tick-borne diseases. And the mold illness, again, of wherever it's coming from, can suppress the immune system. We know that funguses suppress the immune system. We know that parasites suppress the immune system. All these things suppress the immune system. And then you're trying to fight a tick-borne infection that is also suppressing the immune system. And so unfortunately, sometimes these patients get it very immunosuppressed and immunodeficient. And so you have to sort of peel that onion and get all these things back in order. So again, I don't know if I'm answering the question. I don't think there really is a way to tell unless you do some blood work, unless you identify a specific trigger that makes more sense leaning one way versus the other. It's hard to know. The bottom line is that you have to treat the MCAS, which is definitely going to be flared with either of those things. Well, I should say definitely. Many times, mold or Lyme are going to trigger the MCAS and make it worse. So you need to get to the root cause of it, but at the end of the day, dealing with the MCAS flare will help a lot. And then you have the time to kind of figure out where it's really started from.
Yeah. All right, we have a couple more. Well, there's several other great questions. It's 8 o'clock. I just want to be cognizant of your time. Are you okay to continue?
I have about 10 more minutes. Let's go to 8:15. Okay.
Okay. All right. Sounds good. Going back to migraines, this is kind of more of a quick question. Migraines related to MCAS or not, or for whatever reason, especially if you have MCAS and or EDS, Botox?
It's such an interesting question because I've had this come up with a number of patients. And I have a few who have really severe MCAS and very severe migraines and have tolerated the Botox surprisingly well with great results. And I'm hesitant to recommend it, and I'm hesitant, to tell them. They ask me, should I do it? And I go, oh my God, that sounds horrible. How can you do it? Because it's a toxin you're putting in your body.
That's what I think.
And yet I have patients who
do really well, even with chronic pelvic pain too. I had a provider that's spoken about that, even with EDS patients, and she does research at NIH. She's a fantastic provider, and she's had amazing results with chronic pelvic pain or endometriosis and Botox, even in patients in our community.
Exactly. So again, I have not been able to find, what it is that is going to make one person react more to Botox and one person, respond. So I think all these treatments are on the table and everything has to be personalized.
Okay. All right. How do you know if increased pain, severe, is from weaning off prednisone or if MCAS is flaring? That's a good general question. Like, how can you tell if you're weaning off a medication and your pain is flaring or if it's MCAS?
Well, I would call it the same thing, actually.
Yeah, I would too.
Yeah. Yeah. So the weaning off prednisone will flare the MCAS.
Yeah.
For sure. Because
prednisone, at least for a little bit. I mean, it's kind of what happens even with going off opioids if you're on them. Not to go into that rabbit hole.
Yeah, it's the same thing. So the since the prednisone is not on board, because the prednisone is treating the MCAS, if you don't have that on board and you're weaning off prednisone, you have to make sure that you have something else or multiple things controlling the underlying MCAS.
Yeah. Okay. Another question, this is a great one, especially because during stress, the holidays and mental health is so important and things can be triggered and flared, is can you touch on MCAS and relation to bipolar, or is it related? Can it be related? Bipolar disorder and MCAS, can they be related?
Yeah, it can be related. Like depression and anxiety can be related.
Or is there any relationship between the two? That's the question.
Yeah, I don't know if I would say specifically. I would say that, again, mental illness can be linked to mast cell activation syndrome, but I want to be clear, not everybody with depression, anxiety, or bipolar have MCAS, right?
Or that MCAS is the cause of it.
Correct. Or that it's a cause of it. They could have MCAS, they could have that. And also, not all patients with MCAS are going to develop a mental health issue. So again, it really depends on where your vulnerability is and what is presenting and where it's presenting. So there may be a link, but I don't know if I can pinpoint it specifically.
I believe that Dr. Afrin, if I'm not mistaken, has either discussed this or is there something published on it?
He has a great publication on basically the link between mast cell activation syndrome and neurologic and psychiatric illnesses. And he does discuss bipolar. I'm just saying that, yes, bipolar, anxiety, depression, schizophrenia, I could probably, make a case for MCAS being involved in all of them. But I'm saying it's not specific, Yeah.
But they're definitely, it is reasonable to consider the link. And I know that even Dr. Alan Pasinki, who's more on the, EDS side and is a wonderful provider, he actually talks about the psychiatric misdiagnosis in a lot of people with EDS and MCAS as they relate to each other because a lot of them have been misdiagnosed with these conditions when it really is either, related to MCAS or POTS or, different things that we all deal with, comorbid conditions. I'm not being totally specific, but that they can look a certain way, but the cause of it is not necessarily the same.
Right. And I think it's important to note that what looks like anxiety could be a POTS reaction.
Yeah.
And which will then, of course, cause you to become more anxious. So I have patients who I think they have that underlying flavor of anxiety.
Mm-hmm.
Then they have, their POTS acts up, they don't, or even their MCAS acts up, whatever it is. And it triggers that anxiety, what looks like anxiety to others, but it's actually a physiological reaction. And
go ahead.
And that's where it becomes difficult because doctors only see it as anxiety, and as anxiety is mental. And I'm saying that anxiety may be physical.
Exactly. And then you piggyback that on top of those that get the second wind at night, and you're called manic.
Yeah.
So that's all I can say about that. Okay. All right. I'm just looking at the time. All right. We've got about 5 or 10 more minutes, so we can hopefully 4 minutes. Okay. All right.
Sorry, I promised my kids.
You're not allowed to be a mom or do anything else other than be a doctor, Dr. Dempsey. That's it. No. Okay, what about EBV? I just found out that I have a reactive EBV. What can I do to make this better? And I know that, if I'm not mistaken, there's been some discussion about EBV triggering MCAS.
Potentially.
Yeah.
Yeah, I mean, any infection, virus, parasite, bacteria, fungus can trigger MCAS. EBV, so I see a lot of EBV reactivation, a tremendous amount of it, and more than I've ever seen before. And there's no question that stress is a driver of this. I have patients who have had EBV. I've tested them for titers. I know that they have the chronic antibodies. They have IgG. And then all of a sudden, they have the early antigen, which is how we diagnose reactivation, and out of nowhere, right? And you ask them, well, what's going on? And they've had a major event that has put them in this state of chronic stress, and then they're EBV reactivated. In some cases, we'll do a PCR test to see if we can actually isolate the DNA in the blood to see if it's truly multiplying. Sometimes we get a positive and sometimes we don't. Nonetheless, you've got to treat the underlying stressors. That's where the DNRS, meditation, whatever you need to reset your nervous system is critical to get an EBV under control. Otherwise you're not going to get it. The other thing that I see a tremendous amount of is EBV reactivation after something else, like another infection. So tick-borne diseases have been known to trigger EBV. Mold exposure can trigger EBV. Again, they're just other stressors. So you have to eliminate the stressors. So if there's Lyme, you got to deal with that. If there's mold, you got to deal with that. If there are chronic stressors in your life, you have to figure out how you deal with that. Everyone is going to deal with it differently. And then there are other things that we do. I have herbal protocols that I use. I have homeopathic protocols that I use. Sometimes we use medication. The problem with medication is that the research is a little mixed about which medication is really, really the best for EBV. But some of those antiviral medications that I mentioned earlier, and there are a few others, will sometimes be helpful for the right patient. So again, everything's personalized.
One more question. You cool with one more question?
Yep.
This might be broad, but it might be a great question to kind of lead into maybe the next one, because this is related to another question. Obviously, stress during the holidays, people talk about food, and we can't tolerate food. Food triggers different things. There's additives, food colorings. How do we deal with the stress of that? And maybe we can go into that a little bit more specifically, and why this is important and why it's involved with MCAS, and why this is important, but how do we deal with that? Somebody's asking this I'm just trying to keep it broad and not necessarily specific, but they're talking about high histamine foods, fullness in the ears, there's different things that can happen because of food related reactions, whether it's histamine or additives or food coloring. Any suggestions on how we get through the holidays, the stress, and maybe eat a little?
Oh, gosh.
I know it's a big one, so maybe it'll lead into the next one.
I'm not the right person to talk to about this because I'm a little rigid, to be honest with you.
Yes, so we've learned carnivore.
Exactly. That's right. I forgot we talked about that. But the point is that, this is what I do, but I understand that not everyone can do this. If you don't want to eat something and you know you're going to be sick from eating that, don't eat it. Like I have patients, I have family members, let's say, who know they can't eat something, they eat it, and then they suffer for a week. And I say, well, why'd you do it? They're like, oh, because, everyone was eating. And, and I understand that there's this tremendous pressure, but you have to really protect yourself. You have nobody but yourself. That's what I say.
Yeah. Don't eat something just because you feel bad because you're in somebody's house. I mean,
no, you have to get over that, because it's really, you're never going to please everybody. And if anything, you're going to hurt yourself. And there may be circumstances where you can't do what I'm saying. And I know that, I realize that, but ideally, that's what I would recommend. I would say, look at it, eat before you go to a party, eat what you can eat, bring your own food. Again, none of these are great solutions, I understand, but I feel uncomfortable with patients experimenting on themselves during the season when they're already stressed out, and then they're more likely to get a reaction. It's tough though. It's tough because we're
hungry. I gotta be honest, I'm hungry.
Right.
A lot.
And you want to eat, right?
Yeah, I do. Well, thank you so much for your time. Sorry to anybody if we didn't get to all your questions, but hopefully we'll get to in the next one. Thank you, Dr. Dempsey. Go be with your kids. Everybody, happy holidays, New Year, everything. This is the last webinar for EDS Wellness and the last in this MCAS Expert Series for the year. So thank you for everybody joining us this year. And we look forward to moving forward in the new year. So thank you, Dr. Dempsey. Thank you, everyone. And we'll try to get questions answered. And the links for the pain and MCAS articles. We'll make sure we talked about getting that to people, and people really, any kind of information on pain and MCAS would be helpful.
Maybe we could post that on Facebook so that both, people on Zoom and people on Facebook can have access to it.
Yeah. And I can also send that via email and the newsletter, both through EDS Wellness and then also through Mast Cell Research too.
Okay.
So if we can just compile them, we can post them and then work to send those links to help people, because people really would like the pain and MCAS information.
Oh no, it's very important.
All right.
So I want to thank you, Kendra. This has been a great year and a great series, and I'm looking forward to more. And I want to wish everybody happy holidays and happy New Year.
Yeah. Thank you, everybody, and we'll see you. Thank you, Dr. Dempsey.
Bye.
Bye.